Here is your question.
Okay, I read it.
Few seconds left. Wait till the bell goes. You'll be able to hear the bell, hopefully.
Okay.
Right, so if you have read and understood, considering it communication skills station, kindly please begin. Begin now, please.
Okay. Hello, I'm one of the surgical doctors here. I'm here to talk about you about the late investigation we got to arrange with you an appointment. I want to ask you, what do you know so far?
I know it's a camera passing in my food pipe, but I don't know anything over this.
Okay, so let me explain to you. It's called this camera is an endoscope. It's called an esophageal gastroduodenoscopy. It's a camera that gets into your food pipe to view the things we want to see in a TV screen. And
Yes.
and we can also take a sample of the tissue to know what is the pathology or what exactly the problem in there.
Yes. But how it getting in my food pipe? That will be hurting me?
No. This will not be painful at all. So you have two options. The first option is spraying a local anesthetic to your throat. So it will get numb in your throat. You will not feel it. And the good thing about this that you can drive home and you can eat once that this numb goes away. But there is another option, which is sedation. When you be in a state that you're not full asleep, but you cannot remember what will happen. But in this case, you need someone to drive you home and stay with you to the other night until you regain your full consciousness.
Yes. Is there any possible risk of this maneuver?
Sir, there is no maneuver without risk. But it doesn't mean that it must happen. The risks in this maneuver will be maybe damage to your teeth during the inserting the endoscope. It can be also an infection or a bleeding, and in the serious risk is getting a perforation, but is uncommon complication.
Oh, it looks like so risk. Is this too dangerous to me?
No, I can assure you that you will be in safe hands, and the doctor will do this, will be an experienced doctor.
But I'm afraid of this perforation. This very dangerous.
Yes, as I mentioned, the fact that I told you this, that doesn't mean that it will definitely happen. I was just informing you about the complications of this procedure.
If this procedure is necessary for me?
Yes, this procedure is necessary for you to diagnose what is the problem of your throat and your swallowing.
So I have a cancer or what?
No, sir, it's early to decide something like this. After the investigation and getting the results, we'll discuss these things with you later.
Okay. When the result of this maneuver will be available for me?
After 2 weeks from now, and after that, we will contact you to come to the outpatient and discuss with you.
Okay. summarize and consent.
Tell about the food around the eating around the time of ODD. What he can or cannot eat or drink.
When you use the local anesthetic, he can drink hot drinks from 30 to 60 minutes after the procedure. But after the sedation, he can't eat until he regains his full consciousness.
What about, can I take the medicine for my blood pressure?
Yeah, yes, you can take your medicine with a sip of water.
Okay.
And about eating before the procedure, if the procedure was in the early morning, you can't eat anything after midnight. And if it was in the afternoon, you can at least at 8 p.m. it will be your last meal. Okay. And I prefer something light.
Doctor, if I don't want to go through this procedure, what alternative can you offer me?
Actually, the alternative is barium swallow, which is a contrast. You are drinking and getting a serial X-ray, but it will not give the same results, and we cannot take a sample.
Okay. So exactly how can I avoid not going through this procedure?
I didn't get the question.
Actually, I'm afraid of the risks. So how can I avoid not going through this procedure? Why is this procedure so important for me? When you say I don't even have cancer right now.
No, I didn't say this procedure is important because the sample we are getting will confirm whether the thing you have is a cancer or not.
How would that tell you that I have a cancer or not?
After taking the sample, we will send it to the histopathologist and we'll decide already.
You'll get the result and you'll know.
Okay. I'll get the results and discuss it with you.
Right. Then you can ask your patient to summarize everything that you have explained to him and get the consent from the patient.
All right. So will you summarize what you got from me?
Yes, doctor, are you helping? No?
Hello?
Can you tell me why I keep on salivating?
Because this mass
Yes.
is causing a constriction in your food pipe. So the saliva, instead of going inside, it will get outside.
Does the biopsy, the barium swallow that was carried out, does it show that I have cancer? And how do you think it should be managed?
This barium swallow you did showed that you have a mass in your food pipe constricting this way, but it didn't tell if it was whether a cancer or not. So to confirm it, we need this tissue sample.
All right. Okay. Good. Thank you.
Thank you.
So, at the end, you will ask the patient to summarize it for you. And then you'll say, okay, if you agree, then kindly sign this consent form. And that's how this station will be concluded. Good.
Cool.
Thank you.